Hi, hello friends, good morning to everyone. Welcome to our channel, The Voice of Nurse. Today we are going to discuss a very important topics from the nursing, the blood pressure and venous pressure. What is blood pressure and venous pressure, and also additionally we are going to discuss pulse pressure also. So in this class we are going to discuss related to the blood pressure, venous pressure and pulse pressure. Before moving on to today's class, what we finished till now, just we will check it once briefly. Till now we finished related to the nursing point of view. All subjects, 95% of subjects we already finished, each and every subject. 100 MCQs and FAQs we already finished. Almost 2000 MCQs finished from the nursing point of view. Related to the nursing point of view, we finished anatomy and physiology, sociology, nutrition and fundamentals of nursing, first aid, sociology, nutrition, obstetrics and gynecology, mental health nursing, child health nursing, medical surgical nursing and also nursing research and management. Plus along with nursing subject we finished 5 sets of model papers, means 4 sets of model papers and 1 set of mock test from the TS/MHSRB mock test also. I explained detailed about mock test also, and 3 sets of NHM, 2 sets of NHM of previous year 2022 and 2023 January NHM exam paper also I explained clearly. And also we finished till now 2000 MCQs successfully. We finished 2000 MCQs. Along with 2000 MCQs, last classes we discussed related to the very important topics from the nursing. 50 topics in the part 1, 50 topics in the part 2. Totally 100 topics we discussed detailed in the previous classes. Along with these topics, please read about all subjects of nursing and 100 very important topics plus MCQs also very important. So please read about subjects also. Previously briefly we already discussed related to the CPR techniques. I will give a link in description. Please check it once friends. Anybody not seen till now, please check it once related to the CPR class also. For the TS/MHSRB exam purpose, August 2nd exam was there, so we had to download the hall ticket. Already 23rd July onwards we had to download the hall ticket, but TS/MHSRB is not uploaded in 23rd. From the 24th, means from the Monday onwards, Monday evening onwards, hall ticket download process is going on. So anybody not known till now, and also anybody not downloaded and any errors related to the downloading while downloading the hall ticket, means you can consult the nearby your internet set and Mi Seva members related to the hall ticket issues. Let's move on to today's topic, blood pressure and venous pressure. Related to the nursing point of view we are going to discuss today's class. Before the today's class discussion, a small request friends, anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification, and also please like a video. If the content or class is useful to anyone, please give a like and share the video to your friends. Share your opinion in comment section. If you have any doubts related to the topics, you can ask directly in comment section. Today's topic related to the blood pressure. First we are going to discuss in today's class. Related to the venous pressure and pulse pressure we will discuss in the upcoming classes. Why? Because of too lengthy related to the blood pressure, so I am explaining 3 topics in 2 classes. Next upcoming classes we will discuss related to the pulse pressure and CVP. Today's class what we are going to discuss briefly we will see once. What is blood pressure? Definition of blood pressure. What is normal blood pressure? Types of blood pressure. What is SBP and DBP? SBP and systolic blood pressure. DBP means diastolic blood pressure. And which value is risk for the human beings? Which blood pressure value is risk for the human beings? Then categories of blood pressure. We are having categories of blood pressure and whether blood pressure will cause stroke or not. What are the warning signs in blood pressure? How to avoid the blood pressure, means how to avoid the high blood pressure, not blood pressure, how to avoid the high blood pressure, and how to control the high blood pressure without medication. Without medication, how we will control the high blood pressure, and health education to a client with hypertension. Role of nurse in the client with hypertension. We are going to discuss these many topics in this today's class. Now we will discuss related to the blood pressure introduction. Blood pressure. Blood pressure is the measurements of pressure or force of blood inside the arteries. Blood pressure is the measurements of pressure or force of blood inside of the arteries. When we are monitoring the blood pressure in the client through the BP operators, the blood pressure is the measurements of pressure. How much pressure will come from the blood inside of the arteries, that is called as blood pressure. Each and every time our heart beats, it pumps blood into the arteries and that carry blood throughout our body. So each and every time our heart beats, it pumps blood into the arteries, then the blood will carry throughout the body. This happens 60 to 100 times a minute, 60 to 100 minutes for a minute. For 24 hours, same process will happen. Arteries deliver oxygen and nutrients to whole body so it can function. So arteries will deliver oxygen and nutrients to the body. Here blood pressure definition we will see now. Blood pressure is the pressure of circulating blood against the walls of the blood vessels. Most of this pressure results from the heart pumping blood through the circulatory system. The definition of the blood pressure is the pressure of circulating blood against the walls of the blood vessels. Most of this blood pressure results from the heart pumping blood through the circulatory system. When used without qualification, the term blood pressure refers to the pressure in a brachial artery, where it is most commonly measured in the brachial artery. So, the ideal blood pressure is considered to be between 90 to 60 mm of Hg and 120 by 80 mm of Hg. High blood pressure is considered to be 140 by 90 mm of Hg or higher. A normal blood pressure can vary between the individuals, but the American Heart Association recommended a target blood pressure below 120 mm of Hg. Systolic blood pressure is 80 mm of Hg. Blood pressure is the pressure of circulating blood against the walls of blood vessels. Most of this pressure results from the heart pumping blood through the circulatory system. Next we will see blood pressure related. What is normal blood pressure? A normal blood pressure level is less than 120 by 80 mm of Hg. This is normal blood pressure level less than 120 by 80 mm of Hg. Ideal blood pressure is considered to be between the 90 by 60 mm of Hg and 120 by 80 mm of Hg. The high blood pressure is considered to be 140 by 90 mm of Hg or higher. In case of blood pressure is 120 by 80 mm of Hg or lower, is called as elevated blood pressure. The normal blood pressure for most adults is defined as a systolic pressure of less than 120 and a diastolic pressure is less than 80 is called as normal blood pressure for a most in adults. Blood pressure is vary according to the age and different between the individuals, means each and every person is having not equal blood pressure. So blood pressure is vary in individuals and blood pressure is different values will come according to the age also. Next we will see types of blood pressure. We are having two types of blood pressure, systolic pressure and diastolic pressure. Means systolic blood pressure SBP, diastolic blood pressure DB. Now we will see in detail about systolic pressure and diastolic blood pressure. What is systolic blood pressure? Systolic blood pressure is the pressure when the heart pushes blood out is called as systolic blood pressure. Diastolic blood pressure means the pressure when the heart rests between the beats. This is called as diastolic blood pressure. Means detailedly I will explain now. Systolic pressure is the pressure when the ventricles pump blood out of the heart is called as systolic blood pressure. Diastolic blood pressure means the pressure between the heartbeats when we are taking rest, or heartbeats when the heart is filling with blood. This is called as diastolic blood pressure. The systolic pressure is the pressure when your heart pushes blood into the out of the heart is called as systolic. And also otherwise blood pressure readings are made up of two values. These are systolic blood pressure and diastolic blood pressure. Now I will explain regarding systolic blood pressure is the pressure when the heart beats while the heart muscles is contracting or squeezing and pumping oxygen rich blood into the blood vessels is called as systolic blood pressure. And diastolic blood pressure. What is diastolic blood pressure means? The diastolic blood pressure is the pressure on the blood vessels when the heart muscles will relax is called as diastolic blood pressure. Also systolic pressure is called as and diastolic pressure is called as. Here what is first number, what is second number in the blood pressure means, if in exam we got like this means all you have to know. First number means systolic pressure, second number means diastolic pressure. Here what is systolic pressure, what is diastolic pressure? Nothing but systolic and diastolic pressure. And also systolic and diastolic pressure also called as first number and second number, and also other name for the first number, second number or systolic and diastolic pressure is top number and bottom number. Top number is also called as systolic pressure, bottom number is also called as diastolic pressure. This is related to the systolic and diastolic pressure. What is normal blood pressure? Normal blood pressure can vary between the individuals as I am said in the previously, but the American Heart Association recommended a target blood pressure systolic is 120 mm of Hg and diastolic is 80 mm of Hg. This is normal blood pressure. This is normal blood pressure value. Normal blood pressure is systolic was 120 mm of Hg and diastolic was 80 mm of Hg. Otherwise the first number is 120 mm of Hg, but bottom number is 80 mm of Hg. Which is more important in blood pressure? In blood pressure, which is most important, systolic or diastolic blood pressure? Recent findings generally in studies in which readings of systolic and diastolic blood pressure have been compared. Systolic blood pressure has been a better predictor of risk. So systolic blood pressure is very important value in the blood pressure. Which is more important in the blood pressure value means systolic blood pressure value is predicted as a risk. So here systolic blood pressure is very important in the blood pressure. Next we will see the categories of blood pressure. What are the categories will comes under the blood pressure? We are having 4 categories of blood pressure. Those are normal, elevated, stage 1 hypertension and stage 2 hypertension. What is the normal values of these categories we will see. Normal blood pressure, the systolic blood pressure is less than 120 mm of Hg and diastolic blood pressure less than 80 mm of Hg is called as normal blood pressure. Means 120 by 80 mm of Hg is the normal blood pressure. Next, second category, elevated. Elevated means the systolic blood pressure is 120 to 129 and diastolic blood pressure is less than 80 mm of Hg is called as elevated blood pressure. Means 120 to 129 by 80 mm of Hg is called as elevated blood pressure. Next, third one is stage 1 hypertension. Stage 1 hypertension is systolic blood pressure is 130 to 139 or diastolic blood pressure is 80 to 89 mm of Hg. Means either systolic blood pressure will come 130 to 139 value and diastolic blood pressure will come 80 to 89 mm of Hg. Fourth category of blood pressure is stage 2 hypertension. In stage 2 hypertension, systolic blood pressure is greater than or equal to 140 and the diastolic blood pressure is 90 mm of Hg or higher is called as type 2 hypertension means here the value was 140 mm of Hg or greater than, and systolic blood pressure is 90. So 140 by 90 mm of Hg is called as stage 2 hypertension. These are 4 categories of blood pressure according to the systolic and diastolic value. The normal, elevated, stage 1 hypertension and stage 2 hypertension. We are having 4 categories of blood pressures. Next we will see whether the blood pressure will cause stroke or not. High blood pressure will cause stroke or not, we will see now. A high blood pressure reading above 130 by 80 mm of Hg can increase the risk of stroke. Elevated blood pressure can be cause various physiological changes such as damage to the blood vessels of the brain and bleeding in the brain. These changes can cause ischemic or hemorrhagic strokes, or strokes due to small vessel diseases will happen. So what blood pressure will cause stroke? Whether blood pressure will cause stroke or not means obviously yes. Why? Because hyper means hypertension or high blood pressure will cause stroke. Next we will see warning signs of high blood pressure. We are having warning signs of high blood pressure. If blood pressure is extremely high, there may be certain symptoms to look out. The includes following: severe headache, chest pain, a hard breathing, nosebleed, fatigue or confusion, vision problems, and irregular heartbeat, blood in urine. Here irregular heartbeat is called as arrhythmias, blood in urine called as uremia. So all are the warning signs of high blood pressure. Severe headache, nosebleed, fatigue or confusion, vision problem, chest pain, irregular heartbeat and blood in the urine, a hard timing breathing. These all comes under the warning signs for the high blood pressure. How can avoid high blood pressure? How to avoid high blood pressure means prevention of high blood pressure. Here we are having the preventive measures of blood pressure. We will see eat healthy diet. First one is eat healthy diet. Eat healthy diet. Choose healthy meal and snacks options to help you avoid high blood pressure and reduce the complication. Eat healthy diet is best option to take dietitian or nutrition help for the healthy diet. Second one is keep yourself at a healthy weight. To maintain a good healthy diet as well as you will get according to the healthy weight. Then third one is physical activity. Physical activities, yoga, meditation and small exercises will comes under the physical activities. Daily routine activities comes under the physical activities. Next fourth one is enough sleep. Enough sleep. Get enough sleep is best option for the reducing blood pressure, because of during the rest time blood pressure will come down. That's why enough sleep is the best option. Fifth one is do not smoke. Do not smoke and avoid alcohol. Do not smoke and avoid alcohol. Alcohol and smoking both are the high risk factors in the hypertension and also some of the other conditions. Most commonly related to the heart and lung disorder occur due to the smoke and alcohol only. Make sure to do not smoke and avoid alcohol or limit intake of alcohol, also one of the preventive measures. We will see how to control blood pressure without medication, or without medication how we can control the blood pressure. We will see one by one. Reduce stress. First one is reduce stress. Second one is exercise regularly. Third one is eat healthy food. Fourth one is lose extra pounds and limit alcohol, reduce salt in diet. So if we are doing these things, reduce stress, exercise regularly, eat healthy food, lose extra pounds what we gained, and limit alcohol intake and reduce salt intake in the intake or in the diet, we can treat the blood pressure, means high blood pressure, with the normal modalities. Without any medication we can control the blood pressure. Through these ways we can control the high blood pressure without medications. and also we are having good or appropriate in the night sleep, good or appropriate night sleep, and also monitor the BP at home, get regular checkups also, monitor the BP at home and get regular checkups as the physician orders. We can take a medication in case of higher BP. Non-controlled BP means we can take a medication as by doctor's advice, but the blood pressure is we can treat or we can control the without medication through these many ways. What is the role of nurse or nurse role and health education in the hypertensive patient? Citrus fruits. Citrus fruits may help the blood pressure will low. Citrus fruits will help the blood pressure will low. And salmon and fatty fibers. Salmons or other fatty fish are the excellent source of the omega-3 fats which have significant heart benefits. And also leafy greens. Leafy greens means green leafy vegetables or leafy greens. Olive oil, berries, blackberry or greenberry, these all things comes under the berries. Nuts and seeds. Nuts and seeds also having very much low blood pressure quality. Hypertensive diet. Hypertensive diet means if what not to eat in during the hypertension. Hypertension can cause the health problems over time, including heart diseases and stroke. So salty foods we have to avoid. So means we have to control the salt in the diet, and we have to encourage client to take fruits 4 to 5 serving a day, vegetables also 4 to 5 serving a day. Fat free or low fat dairy products we can provide to the client as a health education in the health education. Lean meats, poultry and fish, nuts, seeds or dry beans and peas, these all things comes under the dietary hypertensive diet or dietary management for the hypertensive clients. And also dietary approaches to stop hypertension. DASH, dietary approaches to stop hypertension, is an eating plan rich in fruits, vegetables, whole grains, fish, poultry, nuts, lumens and low fat dairy. These foods are high in key nutrients such as potassium, magnesium, calcium, fiber and protein. These can reduces the blood pressure. These all are the best diet for the hypertension. And also without medicine, how to control blood pressure. Just now we discussed already without medicine how we can control the blood pressure. And sodium low in diet means salt restriction we have to provide to the client. And regular BP checkups. Regularly we have to advise the client regularly BP checkups is needed for the high blood pressure. And exercises and daily physical activities is the very important in the hypertensive client. Low salt and rich in fruits, vegetables, whole grains, has said already discussed. The diet was first created to help lower high blood pressure. It is also a healthy way to lose a body weight. This is related to the role of nurse and health education about the hypertensive client or hypertensive diet. Next we will see what is banana's role in blood pressure, what is apple role in the blood pressure, which organ will control the blood pressure, we will see now. First we will see what is banana's role in the blood pressure. But you might not know that banana keeps high blood pressure at bay. This fruit is packed full of potassium, an important blood pressure lowering mineral. Potassium helps balance sodium in the body. Next, we will see what is apple role in banana. You have heard already, I think, that an apple a day keeps the doctor away. Means apple will helps our heart to avoiding blood pressure. So what is the apple role in the blood pressure means take a apple a day means one apple to have to take a day, and keeps the doctors away means we are protecting ourselves while taking apple to intake. Daily intake means we are protecting ourselves from the blood pressure. Next, which organ will control the blood pressure? Blood pressure will control, which organ will control means obviously all of will say heart only, but heart is not correct answer. Kidneys or the main organs are involved in the blood pressure. Why? How? The kidneys is the main organs involved in the controlling of blood pressure. Blood pressure can be described as the resistance of blood vessels acting against the blood flow generated by the heartbeat. But the kidneys are able to regulate blood pressure through the two main actions. That's why kidneys are the organs to control the blood pressure. Which organ will control the blood pressure means obviously heart only, but no one knows about kidneys. Kidneys is the main organs involved in the controlling of blood pressure. Why? Because of the fluid resistance of the blood vessels acting against the blood flow generated by the heartbeat. So this is related to the blood pressure. Blood pressure related to the today's topic we discussed till now. What we discussed we will see briefly. What is blood pressure? Definition of blood pressure. What is normal blood pressure? Types of blood pressure. What is systolic blood pressure and diastolic blood pressure? Which values is risk in blood pressure and blood pressure value? Categories of blood pressure. Whether blood pressure will cause stroke or not. Warning signs related to the high blood pressure. How to avoid high blood pressure and how to control the high blood pressure without medications. Health education to a client with hypertension and nurse, role of nurse in the client with hypertension and hypertensive diet also. These all things we already discussed till now. In upcoming next class we will discuss related to the venous pressure and pulse pressure. We finished blood pressure, then we will discuss upcoming classes and left two topics. Anybody here new to this channel, please subscribe my channel, click on the bell icon for further notification. Share the video to your friends, and if content is useful, class is useful to anyone, please give a like and share your opinion in comment section. Thank you so much for watching. Stay tuned friends. Keep watching.